Welcome. While we're waiting, I'll just say I woke up with the biggest smile on my face today because so happy to be celebrating with all of you our first year of this group. It's a big birthday, so I'm very excited that you're here to join us for that.
And today is Earth Day, so there couldn't be a better day to celebrate.
Exactly. It was a very intentional birthday. Absolutely. Thanks, Larry, for bringing that out. And in the meantime, I'm gonna start sharing. I see. We'll give one more minute and then we will start. Thank you for your patience. Yeah, later today I'll be going to my kids' school to do a little bit of Earth Day activities with them. And looking forward to that too. It's always fun to tell kids why they should care so much about the Earth and hear their stories about why they care so much. It's always fun. Okay, I think I'm going to start. Welcome, everyone. Thank you so much for being here, especially on this day to where we're going to be celebrating our first anniversary and, as Larry had mentioned, Earth Day. It is no coincidence that these two days collide. It was exactly 1 year ago, we launched this Neuro Climate Working Group with the intention of really celebrating Earth and thinking about how we can protect our brains and our communities as well as our planet. And because I'm a nostalgic person, I want to start the meeting with the first slide I had shared on that day exactly a year ago, welcoming all of you and saying Happy Earth Day. And if you're new to our group, if this is your first meeting, please welcome. We're very excited you're here. Please introduce yourself on the chat so we can say hello to you as well and get to know you. And for those of our more seasoned members, thank you again for being here. So today we will be talking about our 1 year of impact, highlights from what we have achieved together in this 1 year, and share the video of those of us who shared some of their insights with us about the group. And now we're going to have our amazing speaker, Professor Tamma Carleton, talk about the mental health effects of air pollution of our work around this. And then we'll be discussing about having an internal discussion about what we're envisioning for year two, what we can do to make this group better and our work more impactful. And then we'll be wrapping up. So to celebrate, we have created a short video, well, short 7 minutes. So we'll be seeing that and I'm very excited to share that with you.
Happy anniversary, Neuro Climate Working Group. Huge congratulations on an incredible first year. When I founded this group a year ago, I had big dreams, but wow, what we have accomplished in just 1 year has far exceeded my wildest expectations. Our small but
Jen, I think we
don't hear
lost
anything.
the sound.
You're muted if you unmute yourself.
Oh, is that why? Sorry. Let me start. Thank you. So you guys couldn't hear the sounds. I'm sorry.
We saw like the very beginning with your face was good, and then we lost
And
it.
then when I turn, okay, thank you so much. And apologies for that. Let me see. I'll start from the beginning. I thought if I mute myself, you would be here better, but oops. Okay, let's go again. Sorry about that.
Happy anniversary, Neuro Climate Working Group. Huge congratulations on an incredible first year. When I founded this group a year ago, I had big dreams, but wow. What we have accomplished in just 1 year has far exceeded my wildest expectations. Our small but mighty group of 30 plus members turned into a community of 160 from 38 different countries. We have built a truly multidisciplinary community spanning neuroscience, psychology, climate science, public health, sociology, economics, and architecture and beyond. We have created the most up-to-date and comprehensive report on climate change's impact on mental and neurological health, which will be available publicly soon. We have launched our 5 global research projects, contributed to dozens of scientific articles, and spoken at global forums from United Nations General Assembly to COP to others. And our webinars and training materials have reached thousands of healthcare professionals worldwide. But this is just the beginning, and we still have so much more to do, and none of this would be possible without you. This community is truly extraordinary. Its dedication to protecting the planet and its people, its passion for driving real change, and its generosity in sharing knowledge, opportunities, and resources make this group one of a kind. But don't just take my word for it. Please hear from our incredible members themselves. And thank you for being a part of this community, part of this movement, and your contributions are making the world a better place. Thank you.
It's my honor to congratulate the Neuro Climate and Health Working Group on their 1-year anniversary for their exceptional contributions to our understanding of climate-related neurologic impacts. What really distinguishes this working group is its truly multidisciplinary composition. Neurologists working alongside epidemiologists, environmental scientists, and public health experts from across the global healthcare community. This collaborative approach is actively bridging critical knowledge gaps that no single specialty alone can address. The working group model of specialized expertise, international collaboration, and solution-oriented research serves as an exemplar for addressing the complex health challenges that climate change presents on our patients and our communities. The GCCHE couldn't be more delighted to support this work, and I know that together we will find a way. Thank you for all the work that you do.
I firmly believe that the Neuro Climate Working Group is essential because climate change also represents a brain health crisis. Today, we know that heat, pollution, and displacement affect cognition and mental health, and its connection is often overlooked. This work group stands out for its collaborative and interdisciplinary approach. In just 1 year, it has brought together researchers and policymakers to drive action. It's truly inspiring to be part of this team that is bringing a lot of solutions. So happy anniversary to the Neuro Climate Working Group, and I hope the best is yet to come.
I'm very happy to join the Neuro Climate Working Group.
This is to wish everyone a happy anniversary in our Neuro Climate Working Group. I can't believe it's already been a year. This is such an incredible community. And together, I really feel that we are uniting and creating projects together and working together and inspiring each other to generate greater climate resilience in our communities.
I've recently joined the Neuro Climate Working Group, and it's very exciting to be part of this large group of scientists, researchers, policymakers that are really thinking about the intersection between climate and neurological health and health. I'm very excited to contribute my knowledge in the area of architecture, indoor environment, outdoor environments, and spatial and built environment questions to this group to try to really examine and uncover how our built environment can do a better job. Not only to be resilient to climate change, but to also ensure better health and neurological health outcomes for its users.
What I like about the team is the multidisciplinary collaboration and international collaboration brings, and also the collaborations including the monthly meetings and trying to change the narratives on climate and brain health.
I'm proud to be among the founding members of the Neuro Climate Working Group, a global alliance which is focused on the intersection of climate change and brain health. Over more than 25 years in the brain health ecosystem, I've seen how our understanding of the brain has evolved, from studying an organ to recognizing that the brain is impacted by the rest of the human system and by the external environment. But the challenge remains how to foster greater collaboration across the relevant fields, disciplines, sectors, and lived experience in countries around the world so that we can share knowledge, build more robust data sets, and ground policy and implementable solutions in an understanding of different perspectives and contexts. Congratulations on a remarkable first year. I'm excited to be part of the journey ahead.
This is a unique platform where we can exchange our knowledge, get a learning from the different global experts about the climate change and mental health, neuro health. I got a lot of insights from this group, which really give me an opportunity to understand the mental health, sensitivity of the mental health, neuro health at every level of the policy planning decisions. So while developing the policy and advocacy strategies for public health, health department, so I'm trying to inbuild the climate change and mental health in that policy advocacy documents, which really address the vulnerabilities of the community at the grassroots level and far-flung areas of the province of Balochistan, Pakistan.
This group has really become a truly special space where neuroscientists, climate scientists, and everything in between can come together in ways that are not only meaningful, but also urgently needed. I've already gained so much from being a part of this network, and I know that I am not alone in that feeling. This group has given researchers across disciplines a place to connect, share ideas, and push the science forward in ways that wouldn't have been possible otherwise. Congrats on this 1-year anniversary. I'm really proud to be part of this initiative, and I really cannot wait to see where it goes from here.
All right. Well, thank you so much for listening in. Let me try to see if I can. Oops. Let's see. Sorry for my technical difficulties here. I'll just stop sharing and reshare again. But in the meantime, special thanks to Cecilia, Ines, Sherif, Shaukat, Mohammed, Jibril, Josephina, Kim, and Ilan, whose video I'll be sharing later for sending the videos. And it's very, oops, sorry about that. Just let me start resharing. But before I do that, okay, can everyone see it okay? There we go. So like we said, our group, when I started this group, we had about, in our first meeting, we had about 40 members. And within 1 year, we really quadrupled in size. Today, we have 172 members. And we have become truly a global and multidisciplinary network from 40 our members span from 40 different countries and 31 different fields, anywhere from brain health sciences such as neuroscience, psychology, to economics, as we will hear from Tamma today, who's a climate economist, as well as environmental science, neurology, pediatrics, psychiatry, and architecture and policy. So we're very excited how much representation of different fields and different cultures and different countries are within our group. And within 1 year, we had 12 meetings, and special thanks to all our speakers who have joined and shared their insights, shared about their works. As you can see, it spans quite a bit, from anywhere looking at the effects of air pollution on children's brains to thinking about the neurobiology of climate anxiety and built environments and brain health. And we have been learning so much from you and sharing knowledge, sharing insights together, which is a really incredible learning environment for all of us. And our work has really expanded the scientific knowledge in this area in many ways. As I speak about our group, I often hear people saying, "Oh, wow, you guys are building a new field." And I really feel that we are really expanding the knowledge base around how climate change impacts our brains. One of the major accomplishments has been creating the State of Science report with 28 of our members coming together, compiling all the scientific evidence on how heat air pollution, water soil contamination, vector-borne diseases, and so on. The 6 different factors that are related to climate change affects our mental health, affects our neurological health and cognition. And this will be publicly available hopefully soon, sometime in the summer. But we have been already sharing this report with representatives from UN, various organizations, and anybody who's curious, and been getting a lot of great feedback. And our contributions have been part of more than 10 scientific publications. And our members have initiated big global research projects that had included members from our groups, leading to big global research collaborations. This includes the Click Brain project in the leadership of Professor Agustin Ibanez, and the Global Brain Health Institute. Dr. Kim Dole started a hot cognition many labs project that has many members from our group are involved with. We are just launching with Professor Yoko Nomura a resilient brains project that already so many of us have come together working on. We had Dr. Pooja Sahni had started a regional group on South and Southeast Asia neuroclimate, starting a new project thinking about air pollution and climate change and how they affect children's cognition. And Professor Sylvain Desiris and Shazia Adalet and others have been working on heat and cognition related projects as well. Heat and mental health, apologies. And our advocacy, we had the opportunity to really talk about our group and our work in platforms, including United Nations General Assembly, COP29 side events, to many different global and national platforms where our awareness efforts had reached thousands of healthcare professionals, as well as students and the general public. We had the opportunity to partner with really big global organizations that work around brain and the neuroscience, as well as in climate change. One of those opportunities was doing a collaboration with Pan American Health Organization, where we were able to create a climate emergency pamphlet where we were able to on how to prepare when climate emergencies happens, what to look for neurologists and psychiatrists that have is going to reach this year to every neurologist and psychiatrist in Latin America. And this is just the beginning. Our work has already been recognized worldwide, thanks to some of them have been written by our members, such as our brilliant author and journalist Clayton Aldrin had written a piece in The Guardian that came about a year ago that brought a lot of interest to this area of work, and he has been amazing at raising awareness. We had also been interviewed at Bloomberg and different radio stations from Australia to Canada to United Arab Emirates. So if to summarize the impact of our climate group so far, it's been really about building this field and expertise that is much needed when we think about climate change and its effects on our health. And we had been really giving an example of how to do global and multidisciplinary collaborations. I was at a meeting recently and was talking to a cardiologist colleague, and when I had told him about the work we have been doing, he had said that so many times different people talk about multidisciplinary collaboration, but he had never seen it so successfully being able to accomplish. So it's a huge thanks to all your work in that. And we have been able to really increase the knowledge base, provide professional and educational trainings for general public and healthcare professionals and other stakeholders, increase the global awareness and public awareness around these issues. But I think our really biggest impact so far has been creating this incredible sharing collaborative community. This is a really special community, and you made it possible. Even if you have just entered, we feel so grateful and thankful that you're part of this. So I would like to stop sharing my slides, and before we head on to hearing from Tamma, I really want to open it up, and if any of you want to have anything you would like to, a few words you would like to share about the group or about your experience, it would be we would love to hear it.
Can I say something?
Please, yes, Elida.
Yeah. Apart from really joining this group was really a remarkable journey for me as well, but also in the group itself, I felt really acknowledged and felt valued. And this doesn't happen all the time in the communities that we are in. So I would like to thank you as well, Burçin, for being a great leader for us. Yeah, thank you.
Thank
And
you.
happy anniversary.
Thank you so much. That's really reassuring to hear because we really value you and everyone being here and being part of this. Um, I'm going to also point it to Ilan. If you're here, I think you wanted to share some news about a new project we're starting too. I'm going to put you on spot.
Hi, I'm here, slowly virtually merging in. Thank you first and foremost, Burçin, for bringing us all together this year. The exciting news is that Burçin and I have sort of been in the background working on putting together a book. Some of you know this. We'll probably have a dedicated workshop to call upon others to come and join us. It's basically a vision of how we're going to change neuroscience. Let me see. I think I've started to put together notes. You caught me a little bit earlier in the meeting than I expected, but so I should actually tell you. So the book has actually now we've signed a contract with MIT Press. We're super excited about this. Because one of the things that we negotiated was to make sure that the book will be with open publishing. So basically, it'll become available to worldwide. This is going to happen fairly quickly. We have, as some of you know, already chapters in place. I'm going to try to open it up. Where did it go? Here it is. So the book is called. Is it okay if I share a screen on this?
Sure. Yeah.
Let me see. I think it's just going to do it maybe quicker to. Okay. Can you see that more or less? So basically, it's toward an ecological and green neuroscience universe, working title. Our thoughts are going to be what's missing in our understanding of the brain and connection to our ecosystem. It's going to be bi-directional. So we're thinking about how the ecosystem affects our brain, but also how we can change the ecosystem around us, moving away from molecular interactions, talking a lot about multi-scale factors, social conditions, a very holistic approach, in multiple areas, and a lot of it is topics that we've already heard and we'll hear today. So architecture, arts, thinking about the restorative capabilities of our brain and agency. Basically, what it is, it's a hopeful book. And the idea is that we're not just jumping towards the seductive nature of technologies, but rather really thinking, celebrating nature itself and traditional approaches to making our brain healthier. We have a list of sort of outlined chapters, but I'm not going to go through those given the agenda for today. But like I said, we'll have them and we'll be opening an invitation to those of you. We're really hoping to. I'm sure we've missed certain aspects. It's pretty comprehensive. We've thought of everything from the impact, not just climate change, but things like nuclear pollution. But we're hoping to sort of fill in blanks, and that's where having a huge group and an international group like this will really come in. So look out for that call. And that's it for now.
Thank you very much, Ilan. Yeah, we're very excited we got this opportunity to create this book. The MIT Book Press was very excited. We got great reviews when we come up with the proposal, and it's really for everyone to join in who's interested. We had already reached out to some of you about some ideas, but we will be making it an open call to really, you're the right people and your networks are the right people to write it, to think about really outside of the very neuron-centric way of thinking about our brains, but really opening up to more ecological green and really rewriting what neuroscience is. And so we will be talking about that more later, but it's a very exciting new project that will be coming this year. So thank you so much, Ilan.
I just want to add one thing. I forgot. We're really hard negotiators, and one of the things we negotiated was a free copy of the book to any contributor. So if that, MIT books can be expensive. So yes, you can download it for free, but if you want a hard copy, um, get in touch with us and add a chapter. So
yeah,
it's a pitch.
Yeah, our biggest bargaining was that we said we want to make it open access, open access, open access, which you can imagine that for a book press companies, it's a big no, but Elon was very persuasive and we got it. So we're very excited about that. So it could be in any libraries around the world for free for everyone to reach. Great. Any other words or any comment? Okay, if not, then I'll continue sharing and I'll move on to our very excited to be introducing you to our incredible speaker today, Professor Tamma Carleton. I was earlier this month, I was in Cartagena, Colombia, attending the speaking at the World Health Organization's Global Conference on Air Pollution and Health. And this was a really great opportunity. With my colleague, Alessandro Massassa, who's a member of this group as well, we had an opportunity to talk about mental and brain health impacts of air pollution in their venue, and to be able to speak with policymakers and health ministers and World Health Organization officials about these effects. And some of the work we had to talk belonged to Tamma and her hard work in thinking about how regulations in air pollution can have actually quite positive impacts on our mental health. And I'm also excited to announce that we're slowly starting this collaboration with World Health Organization. They're really interested in creating educational and training modules on brain health impacts of air pollution and climate change. So we will be in the coming months starting a collaboration, and I'll be telling more about that opportunity. So for anybody who wants to join those efforts as well. And with that, I'm very excited to introduce Tamma, because her work was really convincing everyone that it's really important to act on air pollution before its positive impacts for the potentially positive impacts of curbing air pollution on mental health. Professor Tamma Carleton is an assistant professor of agricultural and resource economics at University of California, Berkeley. Her research combines economics with data sets and methodologies from remote sensing, data science, and climate science to quantify how environmental change and economic development shape one another. Her work focuses on climate change, water scarcity, mental and physical health, and the use of remote sensing for global scale environmental and socioeconomic monitoring. She's a member of the Climate Impact Lab, a research affiliate at the Environmental Markets Lab, a faculty advisor and affiliate at CGAA, and a Beijing Young Scholar, a faculty research fellow at the National Bureau of Economic Research, and a member of the National Academy of Sciences Environmental Health Matters Initiative Standing Committee. She holds a PhD in agriculture and resource economics from the University of California, Berkeley, a master's in environmental change and management, as well as economics for development from the University of Oxford, and a BA in economics from Lewis Clark College. Welcome, Tamma. We're very excited to hear from you.
Thank you. Thanks for the great introduction. I am very honored to be able to present on the first anniversary. I'm a pretty new member to the group, and so that was like a very exciting introduction to everything you all have accomplished, and I look forward to collaborating more in the future. Are you seeing my screen? Okay, great. I hope that this work is a good example of how this type of group can build on our disciplinary expertise. I think, we've answered some questions with this work, but there's a lot of unanswered questions that I think would benefit a lot from interdisciplinary collaboration with many of the people in this room. So in this work, we're thinking about how and to what extent air quality improvements in China have contributed to lowering the suicide rate in recent years. As I'm sure many of you know, suicide is claiming hundreds of thousands of lives every year, and this is really a stark indicator of a broader mental health crisis in which 300 million people are estimated to be suffering from depression globally. Now, this map is showing a lot of heterogeneity in baseline suicide rates around the world, but one consistent fact we've been seeing in recent decades is that these rates are declining in almost all countries. So this is the global average suicide rate over the last 20 years. And we see that it's declining in places like the OECD, which has a higher baseline rate, but also in low and middle income countries. As you all know very well, there's a lot of complicated interacting potential drivers that could be responsible for these declines: social factors, economic factors, cultural, and potentially environmental factors. So there's lots of research from many of us in this room trying to pull apart individual risk factors from this sort of complicating intersection of drivers. But there's a dearth of evidence in low and middle income countries. This is generally a context where it's harder to get data. And so even though we see about 80% of global suicides in low and middle income countries, there's a lot less research in these contexts. We're going to study China, where you can see on this graph on the right, suicide rates have been falling faster than in any other nation on Earth. And in particular, we're going to look at air pollution and ask whether changes in air pollution over this period may have been one of the factors contributing to suicide declines. So first, we're going to build a statistical model to assess whether air pollution can be causally linked to suicide in China. And then if so, we're going to look at China's recent air pollution control policies and assess how much of that suicide rate decline can we attribute to policies on air pollution. Now, why are we asking about air pollution? Well, if we just look at the data, and this is over our sample of countries and of dates, and I'll talk about the sample in a bit, we're seeing that while that suicide rate has been consistently declining, PM 2.5 has also been rapidly improving. So this graph on the left is showing both of those trends going down, and on the right, you're seeing widespread improvements in air quality. The blue areas are reductions in fine particulate matter, PM 2.5, over this 5-year period. Now, of course, many things are changing in China over this time period. You can see in the graph on the left that the seasonality of these two phenomena are very different. They peak at different times of the year. So whether these two things are causally related is definitely an open question, but these trends sort of beg the question of whether air pollution may be playing a role. There's a body of interdisciplinary work that we're building off of here and sort of setting the hypothesis that possibly air quality could be one of the contributing factors. Some work in neurobiology. Again, many of you are going to correct my slides and tell me what I can say better here, but my understanding is that we have some evidence that particulate matter can lower serotonin, which can elevate suicide risk. There's lots of work showing that other neurotransmitters may also be involved, and then there's some older work showing that possibly there's just general inflammatory responses as well that may be at play. There's then epidemiological evidence that is shown mostly in the US and in Southeast Asia that particulate matter positively correlates with elevated suicide risk and a variety of scales. The mechanisms here tend to be hypothesized, although very difficult to pull apart. Maybe it's direct effects on the brain, maybe it's effects on physical health, which later translate into elevated suicide risk, or even in my field, we have a lot of evidence that air pollution lowers economic productivity, and we know there's socioeconomic links between economic output and well-being, and then increased suicide risk. So we're building on these two types of literature, and in our work, just like the epidemiological work, we face this sort of fundamental challenge, which is that air pollution is inherently anthropogenic, which means that when air pollution is elevated, there's lots of other social and economic conditions that are also changing. And those are usually difficult to observe and control for, and that therefore these relationships in population scale data can be very confounded. So things like traffic patterns, manufacturing activity changes, seasonal trends can all shape suicide directly, even though they are correlated with air pollution, and it can be very difficult to pull apart the causal mechanisms. So our solution in this paper is going to use a meteorological event called the thermal inversion to try to isolate the role of air pollution from all these correlated socioeconomic patterns. The idea here is that these inversion events will trap air pollution emissions near Earth's surface, really substantially elevating human exposure to pollution, even when socioeconomic conditions have stayed the same. So the same amount of emissions are coming out, but we're trapping it near the surface under these events, elevating exposure. And then when we estimate that statistical model, we'll then take that into an assessment of policies that have led to really rapid declines in air pollution since 2013 in China. So I only have 20 minutes. I'm going to do this somewhat quickly, but we're going to try to give you a flavor of both the data and the methods before the results. So on the data side, we're using county by week observations of suicide that are specific to gender and age cohort. These are from 600 counties that are representative at provincial and national levels under the China's disease surveillance point system. These data have been used in a variety of mental and physical health studies in China. You see the studied counties in blue. And these data reveal large seasonal patterns in suicide over time. So we see that peaks are generally observed in spring months, both for men and for women. And as we see in most data around the world, suicide rates for men are substantially higher than they are for women. We combine these suicide data with air pollution and weather data from a variety of monitoring stations, aggregating them to the same scale as the suicide data. And the one thing I want to draw your attention to in these summary statistics is the first line here. So we're measuring particulate matter. That's a fine scale. We look at other air pollutants that are co-emitted in our appendix as well. I'm happy to talk about those. But the first thing to take away is just average PM 2.5 is very high, 54 micrograms per meter cubed. You can think of the Bay Area of the United States in California as about 8 micrograms per meter cubed. So really high levels, but also incredibly high variance, which at least from a researcher's perspective is helpful because we're going to see a lot of changes in pollution that we can use to identify that statistical model. So how do we leverage thermal inversions and what are these meteorological events? So in normal conditions, you see a negative temperature gradient with elevation. There's warmer air near the Earth's surface and it's cooler as you go up. What happens during an inversion event is that a block of warm air gets trapped between these two colder areas of air, and it traps those air pollutants below the warm air layer. This prevents the vertical dispersion of those air pollutants that are being emitted near the surface. This can happen for a variety of reasons. It's often rapid cooling at night, or storm fronts come in that drop air really quickly that is warm and trap that colder air underneath them. So the idea here is you have the same amount of traffic driving around as you would normally, but all of a sudden that pollution can't get dispersed and it's trapped and raising exposure for humans. We measure these inversions using a standard real analysis climate data set. I won't get into the details, but I'll just point out that we can measure them in a variety of different ways, and I'll show you results using different ways of measuring these events. But it's basically like, does that temperature gradient flip? How strong is that gradient, which can increase the concentration of pollutions, or how frequently are you seeing these events happening? In general, we see a lot of inversion events, about 5 per week on average in each of our districts, but these are measured at 6-hour periods, so you can have multiple during the day. And again, there's a lot of variation in these events over space and over time. So we are going to bring those inversion events into what's called an instrumental variables design in econometrics. Again, the problem we face in trying to use observational data to answer this kind of question is all of these many unobservable factors that can conflate a standard sort of regression framework. In epidemiology, a common solution has been what's called a case crossover design, the idea being that we can observe air pollution on a day when we see a suicide occurring and compare that individual's exposure to pollution on days before and or after in which the suicide did not occur. So this solves a lot of the challenges with unobserved variables, but it essentially limits the analysis to comparing within a person or within a location variation over time in pollution. Unfortunately, that variation can still be influenced by many unobservable factors that are changing over time. There's also challenges with measurement error. So we're going to bring in this instrumental variables design. I won't drag you through boring econometrics. I saw that only 1% of the people in the group are economists. I'm assuming this is not fun methodology, but the basic idea is let's just isolate changes in pollution that are only driven by these meteorological events and throw out all that variation that might be due to other correlated variables. You do that in a 2-stage framework. So the first stage, you're looking at the relationship between these meteorological events and particulate matter as measured on Earth's surface where people are exposed to it, controlling for other weather conditions on the surface, and then a suite of other controls that ensure that you're comparing within a location to itself over time and controlling for seasonality and longer run trends. You then take the results from that first regression into a second stage model that relates the weekly suicide rate to variations in pollution that are only driven by those thermal inversion events in the first stage. So only looking at changes that come through those meteorological events, again, controlling for the same controls. We then account for spatiotemporal correlation in air structures, and I'll show you a bunch of different robustness. Happy to answer statistical questions as needed in the Q&A. Okay, so what do we find? First, we document, consistent with a lot of prior literature, that these inversion events that I'm talking about actually do elevate pollution exposure on the ground. In our data, we see that one additional inversion event per week raises the weekly average particulate matter by about 1%. We can also see this with stronger inversions in the middle coefficient. A stronger inversion elevates PM 2.5, and then the number of days in a week where you have any inversion activity, again, highly statistically significantly elevating inversion. So this is elevating PM 2.5. This is just showing that these events are really doing what we think they should do, which is on the ground measurements of pollution go up. When we then take those changes in pollution forward into the second stage model, we find really large effects on the suicide rate. So one standard deviation increase in PM 2.5 causes the weekly suicide rate to rise by about 25%, highly statistically significant. And what's important is that in our sample, this main results that I'm showing you from the instrumental variables design looks very different than a similar model that's very saturated with the type of controls you would normally see in this type of model, but doesn't isolate the role of pollution, just the variation of pollution just coming from the inversion event. So here, this is using variation over time in pollution, controlling for as many things as we can, but we can see the bias in the estimate that comes from all those other socioeconomic, cultural, seasonal factors that could be influencing suicide directly, and these results look really different. And we think that might be partly why we're seeing such larger effects than have been seen in prior work, potentially. So this main result is robust to many different specification changes, spatiotemporal controls, how you treat the weather, et cetera. And we go through great length to show these details in the paper. While we find that this main result is very robust, it's also highly heterogeneous across the sample. So this is this full sample coefficient. It's about 0.008 increase in the weekly suicides per million, per microgram per meter cubed. But this main sample effect appears to be driven almost exclusively by the older population, and in particular, women over 65. The result is about 7 times larger for this group. For men over 65, it's also elevated, but it's very noisy. Whereas for the younger age groups, we're seeing a pretty precise 0. There's no effect of air pollution on elevated suicide in this group. We also see that this effect is larger in the spring and the summer when baseline suicide rates tend to be high. Although there's no difference by urban and rural or rich and poor regions by average PM 2.5, the other main difference we see is an elevated effect in the places where suicide rates are on average very high. So together, what this body of sort of heterogeneity shows us is that for the demographic groups, for the times of the year, and for the regions where baseline suicide rates tend to be high, that's where we're seeing this environmental factor having a really large effect. That could be that baseline suicidal ideation is very high, and that's when an environmental trigger can actually lead to suicide. Although I'd be very curious what other people in the room who think about mental health may also have theories about why we see these patterns in the data. I'm really interested in and have a lot of open questions around why we're seeing this effect be so much larger in older women. I've done some other work on temperature and climate change and suicide, and in that literature, we tend to see it dominated by men. But in air pollution, we're seeing very, very clearly being dominated by women. So this is a case where I would be very curious what others think. We see this as somewhat consistent with a few different literatures, experimental as well as epidemiological evidence showing that respiratory effects of pollution tend to be larger in women and girls, as well as in the elderly. And then a growing body of work on dementia and other aspects of brain health. Potentially others in the room have seen something similar, where I'm seeing in the literature sort of consistent evidence of larger effects for women. This doesn't answer, for me, the question of why, but I think we're sort of building a body of related work pointing towards women being more susceptible. So the other key finding that comes out of our analysis is that the effects appear to be very rapid as well as short-lived. So here you're seeing the effects of these inversion events, which elevate PM 2.5 on the suicide rate over time. And we can see that this cumulative effect over many weeks is driven, sorry about that, exclusively by the week of the event. So when that pollution is elevated, the suicide elevation we're seeing is in the week of the event, but nothing happening immediately in the week following. So this has 2 implications. One, there doesn't appear to be lagged effects, at least over this type of time scale. There could be more chronic effects that we're not able to address with this type of weekly data. But also that we're not seeing displacement effects in which elevated pollution is just moving a suicide that would have happened forward in time. There's no displacement, there's also no lag. So it's an immediate effect, creating additional suicides that would not have otherwise occurred without the event. So now we're going to take those statistical estimates forward into looking at what the role of air pollution control policy in China since 2013, when pollution standards changed dramatically, what the role of those policies has been in reducing suicides over the time period, leveraging what the causal effects that we've recovered in the statistical model. So again, returning to this picture, the question here is, okay, we see these two trending variables, many other things are going on. How much of this black line can I explain by reductions in PM 2.5, looking particularly at this period because the Action Plan of Air Pollution Prevention and Control was enacted in 2013 and led to really unprecedented rapid declines in air pollution. I think I'm not an expert on this in every region of the world, but I think these are rates of decline in air pollution that are quite unprecedented around the world. So when we combine these two things together, we can estimate for each district across the country where we can get sufficient air pollution and population data, the total number of suicides that we estimate were avoided due to those air pollution control policies enacted in 2013. So that's what you're seeing on this map. The numbers reach up to about 120 over this 5-year period for a single district. And here on the right, you can sort of see the wide distribution of lives saved, or in some cases, lives caused by changes in pollution over this period. These regions over here are places where changes in air pollution have actually elevated suicide rates. You can see in the map, those are happening in regions where previous work has shown us that air pollution is increasing actually due to changes in dust as opposed to anthropogenic emissions. So we don't think those are driven by policy as opposed to changes in dust transport in relatively rural areas. When we sum up these estimates across the country, we estimate that about 46,000 suicides have been avoided in 5 years of pollution reductions, and this amounts to about 10% of that overall trend. So to me, this number is, I think, it's an important piece of the puzzle. About 10% of that decline we can attribute to air pollution control. But of course, there are many other factors that we're not explaining in this model that are obviously very important, given that we're just explaining about 10% of the change. There's been some prior work looking at individual regions and individual policies that were enacted to reduce PM 2.5. So we do a little bit of an analysis in those regions to say exactly how much of the suicide trend we can attribute to specific policies. It really varies. So in some regions, about almost 60% of the suicide rate change we can say is attributable to the policy itself. But there are other regions, for example, the Pearl River Delta, where suicide rates have actually been increasing, and what pollution control did was lower the rate of increase, slightly in this case. So just to wrap up, I want to put these in a little bit broader context, just in the context of some of my work. I'm sure there's other contexts that other people can raise in the Q&A of work that they may have done, but I've done some work on climate change and direct effects of temperature on suicide as well. And what I've really learned from this study is just, I think that the role of air pollution may be, depending on the context, maybe a really large part of the question when compared to climate change. So in China, again, about 5 years of pollution reductions avoided about 46,000 deaths. In India, about a similar magnitude of suicides. It took about 30 years of warming to cause the same number of suicides. So I think this is just, to me, sort of hit home the importance of air pollution, particularly given that the levers we have as policymakers to change pollution rapidly are really powerful, whereas changing the climate change trajectory is a very slow, difficult process. So I think both of these lines of research to me are really interesting, and I think elevating pollution in the conversation is really important. Okay, so just to wrap up, hopefully I've convinced you that air pollution, we think, has a really substantial effect on suicide risk in China, but it's only one part of a very complicated puzzle leading to overall declining suicide rates. These effects are immediate and highly heterogeneous, very large effects for older women. And the pollution prevention policies enacted since the quote war on pollution in 2013 have really had substantial effects on suicides and equivalent roughly to about 30 years of warming temperatures in India. I think there's a lot more research that we need in other countries, but also I'm really interested in this group's thoughts on mechanisms. I think one of the limitations of this type of work is I can't say a lot about mechanisms at play here, and I think they're really interesting and important for informing future work. Thanks so much for your time.
Thank you, Tamma. Really, really fascinating work, and it's so interesting. I love your approach of coming and showing this causal inference of how air pollution has a direct link to increasing suicide rates, and how the prevention policies of air pollution are attributable to the decreases in suicide. I think this was one of the only examples we could find when Alea and I were presenting at the World Health Organization on some positive impact of why these policies are so necessary. So, but before I ask any questions, I want to open it up to others to add comments or insights or any questions. Boriana.
Thank you for the really cool talk. Can you hear me?
Yes.
Okay, nice. I really, really loved your work. I don't have a question, but more something I was thinking when you ask about why could it be women and older women in particular. I think also George wrote something in the chat about postmenopausal women, but I think in particular when estrogen gets reduced, estrogen does tend to have anti-inflammatory properties and generally like neuroprotective properties. So that could be one potential link, since we know air pollution increases neuroinflammation, and if these hormones are reduced, this could probably play a role in that.
Thank you.
Yeah, absolutely. That's a great point, and I completely agree with the link to estrogen and inflammation. Exona?
Sorry, can you hear me?
Yes.
Yeah.
Yeah. I was just wondering, have you looked into studies where they take, they do sort of a hair analysis, in this case, maybe elderly women, to really see the long-term exposure specifically to these women to air pollution?
I think the question is if I've looked at those studies. I haven't. I think that's really interesting, and I want to have a big caveat that especially with this type of causal inference framework, it's so much easier for us to get at these acute shocks in a causal way. The chronic effects are probably very large and just really hard, at least with my sort of toolkit, to get at. So I think I would love if you could point me in the direction of the right literature, but I think we're really not speaking to chronic effects, and I think there's probably other types of methodologies that can be really valuable there, and I'd love to look at that.
Sorry, can I just quickly follow up on that? Is that okay? I also want to say another part of it, because it's something I sort of am trying to do myself with research, is you can actually use silicone wristbands as well, to just have people wear it for a week or so and run it through mass spectrometry, and then again you can kind of see a more short-term kind of exposure. Yeah, but I'm happy to share any studies.
Yeah, just really quickly, I think it'd be great to keep talking, because I think that type of technology opens a lot of research doors, and I think there could be collaboration potential here, because even if you have that really great monitoring, it's still very hard to control for all the other things that are happening in that person's life over the 1 week that you monitor them. And so that's where like these tools come in and helping us separate the pollution exposure in that individual that you can monitor really well over time, even with that enhanced monitoring. So yeah, I'd love to talk.
Wonderful. Pooja.
Yeah, thank you so much, Tamma, for this wonderful study. And I saw that you've also done some study earlier with India. And I'm not sure whether I got this right, but you said that that the absolute air pollution levels did not drop, but there were some policies which helped prevent suicides. Is that so?
No, the absolute levels of pollution dropped substantially from 2013 to 2017. And that 2013 was when those policies came into place. And essentially we do two different things. In one part of the paper, we just look at the overall drop and we don't take a stand on particular policies. And then in the regions where we have good evidence on this policy caused this change, we attribute it directly to the policy. But absolutely, the levels dropped substantially over that.
Okay, so I heard that wrong. So I was curious on what you did look into policies, right? So you have some examples of what policies actually worked well.
Yeah, I mean, I think this is a big set of questions. It's not a democratic regime, right? So we're talking about very forceful policies that physically removed factories from populated areas to buffer regions, dramatic controls on who could drive when and where. And so, you know, the China case on the war, I'm happy to share some literature on sort of the policy experiment that the war on pollution was, but it was a very aggressive and successful war on pollution, but also in a regime that, for example, in the United States, there's no way those types of policies would sort of pass through the democratic process because they restricted freedoms in a variety of ways. So that's sort of the overall summary, I would say, but lots more to unpack there for sure.
Just a quick follow-up. You did that policy study also in India?
No, so in India, I was looking at the role of warming temperatures. So this is a case where the dynamics look really different. It actually looks a lot more like it's driven by socioeconomic factors and in men. So I show that temperatures only during the growing season in the regions and populations that are dependent on temperature-sensitive crops, I'm seeing elevations in the suicide rate likely driven through farmer suicide effects coming from temperature. So very different study context, but happy to point you in the direction of that paper as well.
Thank you.
Tamma, Pooja is leading this new project. She leads our Southeast Asian Neuro Climate Working Group, and
I would love to chat.
A project on looking at the effects of air pollution on children's cognition. So, and there's some policy aspects they want to look into too. So perhaps it would be great for both of you to chat afterwards, and I'm happy to join as well to think more about those questions. Thank you. Ilan.
Hi. First and foremost, again, thank you to Burchin for really showing why this is so important. It's a really great talk. I think the fact that we are looking for, and this is sort of what we were talking about in the book, looking for something that's not reductionist, but actually can have a solution. I mean, you've discussed data that not only is measurable quite easily. We're not talking just about climate. We're talking about relatively easily particulate in the air, and the most dramatic outcome, namely death, self-choice death. I mean, this is exactly the sort of example that we would think of. How do we move forward in something that changes how people think in terms of the mind? So the two questions I have, one is refers to the causal aspect. I get a sense that, again, causal is interpreted, unfortunately here, usually as molecular or hormonal. I'm thinking sort of more larger. Did you look at something like social and physical activities? So, for example, when I think of people, that I know that might be in the age group that is susceptible in your research, it's going to be things like when the air is bad. I think they're not going to the activities that were normal. They're not going to go to yoga. They're not going. So that would be the first question. The other question relates to looking at the other question relates to looking at Taiwan, and there's a very specific reason that I would ask that. But why don't I pause on the first question and then see if by any chance.
Yeah, I think this is such a good example that the language we use around causality, there's such economists use it in a very specific way, and I'm sure it's very different. So what I mean is in using a statistical model linking suicide on the one hand to changes in pollution on the other, I can be confident that the relationship I'm uncovering is due to the change in pollution, but not due to other correlated factors. Importantly, I cannot, at least in the current study, map out the entire causal chain. So I know that like A changed, and I feel confident that C was a result, but the B that led me from A to C, I can't necessarily identify. So if, like you're saying, one of the causal pathways is air pollution is higher, people sit inside, they don't socialize, and they don't get physical activity, and then that changes their mental health and maybe elevates suicide risk. I can't isolate that B component. I can just tell you I for sure see that pollution goes up and suicide rates elevate. So I think I don't know if that helps answer your question, but so some of the analysis we did on the timing of these events and the populations that are more or less susceptible was try to unpack what some of those mechanisms might be. So for example, the very rapid relationship we see with no effects of lags, to me, really shuts down the possibility that there was an effect on physical health that later deteriorates mental health, that sort of is through a more chronic mental health deterioration. It's really immediate. So to me, that suggests it's something more direct happening in the brain, but I can't pin that down specifically with my method. So I hope that answered. And no, I don't have direct work on social and physical activity. I think there's some work using like time use diaries where people can look at that, but we don't have that data in this specific context.
Thank you so much. There's so much to sort of unpack in that answer. Just to flag the Taiwan, it's not to take up too much time, but this came up a lot in COVID. So you raised the issue of the political aspects and so forth. I'm just wondering if you had a chance to look at some of the data in Taiwan, because of course it's geographically close. There you have a really good health system in terms of recording and tracking things, but again, without that you have the genetic and cultural similarities without the political differences, and just wondering if you have any data from Taiwan to sort of compare.
I don't currently, but the fact that you're saying there's really good monitoring makes me interested. This was the collaboration with Chinese Centers for Disease Control employees, and so it was very mainland China specific, but that's a really interesting idea. I am working to build a much broader data set on suicide and environmental drivers around the world. We've got like 30 countries right now. I don't believe Taiwan is in there, but I will go look. It's a great idea to sort of try to isolate differences in geographic neighbors with different cultural factors. Yeah.
Thank you.
Thanks.
Thank you. Alok.
Yeah, thanks so much, Tamma, for that nice talk. I really liked it. I'm actually just trying to wrap my head around some of the numbers. So do you see that, so if you see an effective decrease of around 10% due to air pollution, of suicide rates due to air pollution, and you see that it's mostly driven by like reduced numbers in, say, older women, does that add up? Like if you look at the 10% decrease that you're seeing, or rather, is 10% of the decrease in suicide rates accounted by mostly older women as well? So do those numbers kind of add up? That was one question. And the second thing is, what about the remaining 90%? Are there other factors? What do you think explains the remaining decrease of 90%? Remaining 90% decrease? Is it other pollution factors as well that co-decrease with a reduction in air pollution, or is it something else, or is there even ways to tease that apart from whatever you've done?
Yeah, fantastic questions. So on the first, it adds up only because there is an elevated effect in other age groups. It's just much smaller, and those age groups have a lot more people. So what I could have done, and maybe we should, is look at how much of changes in older female suicide rates are attributable to air pollution. And my guess is the overall contribution is much larger. But the way it adds up in the general population is there's still an effect for other age groups in demographics. It's just smaller than the female effect, but there's a lot more of those people. On your second, this study really focuses in on air pollution. Like one of the drawbacks of this sort of causal inference method is I'm really good at isolating one factor, and that model really doesn't tell me anything about the other factors. But from reading the literature in China in general, my guess is most of that 90% really isn't environmental, but instead just the dramatic socioeconomic changes that have occurred in China in recent years. So massive economic growth, shifts in the way that people are working, the economic opportunities that they have, opening to trade. I think most of the reading I have done has been really about more economic factors. There have been some downsides. I think one of the things I looked into with older women, and I know I'll stop talking because I'm running out of time. There's been this dramatic shift in urbanization that has left a lot of older women without their families in rural areas. And so I think that has elevated suicide rates for some parts of the population. So I think there's just broader, rapid cultural and socioeconomic change that's probably playing a role in that 90%.
That makes sense. Yeah. Thanks so much.
Yeah, very interesting insights in that. Thank you, Jyoti.
Yeah, thank you for this awesome talk, Tamma. Obviously, these kinds of links are what need to be, emphasized more in policymaking. And we've been just having a discussion around mechanistic factors that are hard to look at in epidemiological data. But there is definitely evidence even for predispositions, not necessarily long-term outcomes, but if we can monitor the socioeconomics of the regions, like you were talking about, rural, elderly women, and also potentially there should be data on just the health status of regional regional data on health status, such as which would inform physical activity. And even, there's a lot of data on nutrition profiles. So vegetarian diets that are high in protein are protective in older age, especially for women, but not other kinds of diets. So these kinds of lifestyle-based factors, there may be some data at the epidemiological level that can help tease apart these multiple factors, more so from a predisposition, especially because you're saying these are acute effects, not chronic long-term effects. So yeah, it'd be great if there's ways to look at that in the future. Thank you.
Yeah, thank you. I agree. And I think because one of the key findings is that places and groups where baseline rates are high, the effect of air pollution is much larger. So I think that goes along exactly what you're saying. If we can monitor suicidal ideation or other determinants and drivers of baseline mental health, I think that plays a big role in thinking about these acute effects as well.
Absolutely. Shaukat.
Hi, Tamma. Thank you for your wonderful presentation. My question is that have you seen the correlation between the socioeconomic condition, especially in the suicidal rates, which has been decreased? So which could be give us the give us the help to the policy level, policy making decisions. Thank you.
I'm so sorry, but can you say the correlation between suicide and what was the first example you gave?
Socioeconomic.
Socioeconomic conditions, and particularly in the population, like in urban and rural areas. So how have you seen this?
Yeah, there's a lot of prior work on this. I have worked more on the environmental side, but I think the short answer from a large literature is there's a lot of conflicting evidence in both directions. So if you look cross-sectionally, some of the wealthiest regions in the world have the highest suicide rates. But if you look within time series or within location, you'll often see more rural, lower income regions with higher rates. So I think those relationships are really complicated, and I think there's a lot more work to do to unpack those broad spatiotemporal patterns. But I have not contributed substantially to that literature.
Thank you.
Thank you, Tamma. Yeah, one final question. One of the things that, as Jyoti and Boriana had mentioned, to thinking more mechanistically, it was really striking to see how acute soon after the air pollution spikes happen and short-lived those changes that happen in suicide rates. And I was really, it made me think more mechanistically as well, thinking what could be inflammation seems to be very reasonable. We know that air pollution causes quite a bit of inflammation in the brain. And I wonder if there was any, and I know that's something you've been interested in, looking at those cumulative effects of heat and air pollution, just because we know that heat also makes the blood barrier more leaky, allows the pollutants to enter and causes potentially more inflammation happening. If that was something looked at as well.
I haven't. When we control for heat and you see the heat effects here as well, I'm not showing them. And again, those affect men more than women. So the pollution is really on the female side, and the heat effect seems really on the male side. I've not looked at the intersection. And I think now that my group has been assembling a bigger data set, I think there's a lot more statistical power to start looking at those interacting effects. And that's a really good idea.
Great. Thank you. Thank you so much, Tamma. And thank you for all of you
Yeah.
for your insightful comments on that. Well, we have only 5 minutes left, which is great. I love these discussions. This is exactly the point, and I love that we have so many people from different disciplines and background thinking and be able to interact and learn from each other. So thank you so much for this interactive thing. For the last 5 minutes we have left, I just want to open it up and see if there's any feedback anybody can give or any discussion we can have around what do you think, what would you like to see happening in our group in thinking about in our second year, what we can do better perhaps in terms of communication among each other, collaborations, or what would be a great direction to go into to increase our impact, increase our reach. So I'm going to stop sharing again, so I'll open it up for anybody who wants to comment on those as well.
Virgin, thank you for the awesome work that you're doing in translating all this evidence into policy conversations and all the awesome meetings that you're going to, and we all try to do the same. I think this is where the strength of the group is, in this interdisciplinary collaboration between scientists and journalists and policymakers. And so having these conversations is great, and then also amplifying where we're able to really make that change or affect that change, and really celebrating that change and emphasizing it so that our partners around the world can take that example forward. Obviously very excited about the work that Pooja is also leading in the South Asia initiative, and really the goals are to advocate for policy changes with scientific action, and there has to be more of this. And so the more of such exemplars we actually discuss in the group together, I think it would be informative for us all, and so that we can all forge that path. That's sort of the unfamiliar path for all of us. Like, we're very good at our silo expertise, but how do we branch out and do that change making? So if we can discuss more of that, that'd be awesome.
Absolutely. I think that's a great point, Jyoti, and something I always think about too. How can we translate this amazing knowledge exchange into actual actions? And definitely something would love to focus more on. Boriana.
Thanks, Porchin. I just have a small remark regarding bringing our work to the outside. I think it possibly would be quite helpful if we create a LinkedIn profile, Blue Sky profile, like social media profiles where we share updates from our group, but also the research members that do. Because I think, so for me, these kinds of accounts are very helpful for, getting into different fields that I'm potentially interested in, and it could also help recruit new members that work on similar things but have not yet heard of the group. And then we can ask the members that have large social media presence to share once or twice about this new account, and then usually that gets it going rather fast.
Great tip. Thank you so much, Boriana. I'll definitely look into that. And I have not used Blue Sky yet, but that's a great way to get into it. But yeah, LinkedIn as well. It's a great platform now to be able to share our work. Thank you. Ilan.
Hi, so I'm going to go meta on this and say that probably the first suggestion I would make is that we have a 2-hour meeting to brainstorm. Today's talk was terrific and actually very inspiring towards directions that I would have brought up, but I think we need at least 2 hours and probably break that up into groups where people can talk about certain ideas. It could be broken up randomly or by affiliation. Probably both are good strategies. Just off the top of my head, there were at least 2 topics that were brought up in today's talk, which was, measurable aspects of moving beyond climate. And I'll leave the rest, but definitely getting some sort of initial workshop where we divide, and then maybe quarterly or biannual workshops where there's actual outcomes and measurable outcomes. And it's like a 2-hour. I've been in groups like this where there's over 100 people, and it can have a huge impact. But you have to have like a day where it's almost like a research day. And, with papers, but more than papers, something that is more than even just policy, but something that's measurable. That's why today's talk was actually really interesting because it points at things that we could do to say, hey, in the short term, can we measure this? In a local neighborhood area, at a global area, at a state area, right? I mean, it works across scales. So those would be so just to wrap up with going back to the meta, let's have a meeting where, it's all about just figuring out what we're going to do next year would be my suggestion.
Yeah, I think that's a great idea to really have some strategic meeting to think about all these, and I like what you bring about looking at local impact and really more in-depth impacts and more global, large, more broader impacts as well. It would be great to consider. And yeah, Pooja, thank you do you want to just share again about your South and Southeast Asian subgroup? She had posted it on the information, and they do have a LinkedIn. Well, Pooja's way ahead of me. Great job, Pooja. So please also consider sharing that too. We're starting some really great projects there as well. Any other thoughts?
Jeffrey from Malaysia. I'm thinking of our Ministry of Higher Education started some calling for social grants. That means say looking at effects of whatever to society. So after our discussion that day with Pooja, so we got some ideas, but the grants are not huge. They are not, but that will test the collaboration of our local Malaysian scientists and also connect them because we noticed that even in Malaysia, the problems in Borneo and the problems in Peninsular Malaysia are different. The problems in the north are not the same as the problem in the south. And the problem in the East Coast is not the same as the problem in the West Coast. So there are, even though we are not such a huge country, we're just about the size of Germany if combined together. But I think we do not have enough data even in Malaysia, and worse still in Southeast Asia. So I think we want to grow our group, but our group needs direction and experience. So we need I think we need an international sifu, we say, so that we get ideas. So I might be asking more people from Malaysia and around the region to join the group, if you don't mind,
We would
Dr.
love
Lusin,
that.
so that it'll be interesting to jog their memories and their minds, because the government has started some grants, so I think we can make use of these small grants to start looking how we can solve local problems. So if that's okay, then I will contact them, and of course they will contact you.
Yes, absolutely. I think that would be great. We would wholeheartedly welcome all new members that you can think about in joining our group and sharing knowledge and ideas and insights together. Absolutely. Thank you.
And the other thing that is also very interesting, because in Malaysia we have a group of indigenous people. They have a relationship with the Australasians of Australia, the Melanesians of Papua New Guinea, and they stay in the forest. And the change in weather may also affect their brain health. But we do not know. We have not had any contact with them. But my university is closer to where they are placed. So maybe we could do a small project and just have a interview with these people in the forest to see what exactly are the weather changes in Malaysia affecting their so-called mental health as defined by modern medicine. because mental health amongst the indigenous people, I mean, they define it totally different than how we modern human beings define them. But it will be interesting to see a narrative input from their people, to see how those people who have been in the forest for centuries, and they are also influenced by the weather changes, that maybe there are subtle changes in their mental health, even for aborigines. So
Absolutely.
that's something that we could look into as well. Yeah.
I think that's a great idea. In fact, I think we had mentioned, so we're starting a global resilient brains project. This is a global climate resilience and brain health project looking into, and it has multiple layers, and one of them is really looking at these communities, traditional communities, learning from their how they're adapting to these changes, climate changes, and changes in the temperatures and so on. Whether there's, I think, a lot to learn from indigenous communities who live so close and in relation with nature, and they have come up with these traditional ways to really adapt to these changes. And it would be great to learn from them, and then learn with them, learn from them, and see what kind of impact they're going through, how they're adapting, and carried on to look at more mechanistic and population level studies. So I'm happy to share more information. Professor Yoko Nomura and I are leading that effort, and we would love for you to join that too in thinking. So I'll reach out about that too. I think that's a great idea.
Yeah, good. Thank you very much.
Thank you. Thank you so much. I know we're past time, but thank you again for being here, for being part of this community. This is really my favorite job work ever, and I think this is so impactful, and feel very lucky to be part of this group. So thank you all for being here today. Have a wonderful month, and we'll see you next month. Thank you. Happy Earth Day.
Yeah, thank you, Gulshan. I've just emailed you the link again. So if you can find some time, make some time rather. I know you will not find some time and give me some quick input. It'll be really helpful. Yeah.
I'll do it today. Thank you so much, Pooja.
Yeah, thank you. Bye. Bye.